Yeah. Prenanda.
Good afternoon, I'm Councillor Simon Croft and I'm the chair for this meeting.
My name is Councillor Simon Croft and I am the chair of the Social Care and Health Overview and Scrutiny Committee. Can I welcome everybody to the meeting, wherever they are? It's a multi-location meeting. The meeting is going to be live streamed and is being recorded and will be available for viewing after the meeting. Should the live stream fail, the meeting will continue, but the recording will be available afterwards through the website following the conclusion of the meeting. Can I remind members, translation is available. Hopefully we've tested it for everybody now and it's working properly. Please select the English language option on the microphone delegate unit for translation in the room. And for those clicking remotely, go on to audio settings and select ENG. For those wishing to speak, please press your microphone, push the speak button, which is at the bottom of your little unit on the desk. And your names appear in a queue and I will take speakers in turn and as I consider appropriate. Don't use the yellow hand function unless you want to raise a point of order. Okay, I will try and make note of people who do want to speak in case the system forgets, because it does sometimes have a bit of a wobbly. Okay, if your microphone is red, then you are an active speaker, but please wait for me to bring you in. And if you are showing green on your microphone or on your screen, that means you're in the system and in the queue. Right, can I ask that committee members put their mics on first, and once all committee members have had the opportunity to speak, then we will have non-committee members speak after that. Okay, so in order to maintain your place in the queue, don't undo your microphone button because it will forget you. Okay, and those in the chamber will not be able to see the chat facility that people can use remotely. But if you do need to go, please pop a message in the chat function for the Democratic Services Officer. I expect everybody present and participating to conduct themselves appropriately and respectfully. That applies to members, officers and members of the press or public attending. I will ask committee members to speak first when we get to questions and followed by non-committee members. And it would help if you can ask them in one go. Thank you. They should all be focused on the subject matter and avoid repetition. Right, can we have apologies for absence, please, Jane?
Just two apologies, Councillors Sharon Dolman and Abdul Khan.
And I believe Councillor Kay has sent her apologies too. Okay, any declarations of interest under the Code of Local Government? Anybody? No. Okay. Any urgent matters, Jane?
No urgent matters, Chair. Councillor
Conway, did you have a declaration?
Yeah, I just wanted to, my apologies, I have another meeting starting at 2:30 with the Minister for Transport, so I'll have to leave at 2:00.
Okay. Very faint there. Okay. Right. Item 4, the minutes of the previous meeting. Can somebody please propose? Oh, yep. Councillor Sue would like to come in.
Good afternoon. Thank you, Chair, for allowing me to speak. I did attend the 4th of June meeting, just I'm not down as being in attendance. Thank you.
Okay. Yep, could I have...
Councillor Simon, can you hear me?
I can.
Oh, wonderful. All sorted. Just two questions, please, on the minutes. Have we received the promised update to you on the rollout of priority appointments for carers across GP surgeries? Did you pick that up following the last meeting, please?
I don't know. Have we had an update from them? I haven't. No. We will pick that up for the next meeting. Thank you, Cheryl.
And the second one, thank you. Have we had the promised update on the Health Board's views for walk-in appointments at GP surgeries. That was the other one.
Hi, Councillor Cheryl. Just for your information, that the minutes are here only for approval, and I will bring up any actions with the chair after this meeting. Thank you.
Thanks for reminding us.
Brilliant, Dawn. Thank you.
Right, could I have somebody propose the... Yeah, Councillor David. And seconded. To second them, Councillor Austin. Okay, could I have a vote in favour, please, by hands? Any against? Those are carried. Right. Item 5. Questions to Cabinet members. Do we have any? No questions. Okay. Right. Item 6. We will consider a report by the Strategic Director of Social Care and Education on the following matter. Children and Communities Grant End of Year Report. And this will be introduced by Councillor Cathy Augustine.
Thank you so much, Chair. I'm really pleased to share with this committee our CCG report for this year. It demonstrates how we spend this very important grant money and the positive difference that makes to our residents, both in terms of the actual services that are provided and also very much in terms of smoothing out inequalities across our county and providing consistency of support. Ironically, it's often quite challenging to spend all of this grant due to the conditions imposed on its use, but by absolutely rising to that challenge, we are ensuring equality of provision, if it's needed, regardless of where you live in our county. You can see in the report a further, more detailed comment from myself and Councillor Penny Andow. I'm sure you've all read that, so I won't repeat it. And I will hand over to Mark Bowler to take you through the report in more detail. Thank you.
Thank you very much. Am I online? You hear me? No? Closer. I know I speak quietly. So I'll do the best I can. I don't have a loud voice. I'll try to do my best. So if everybody can hear me. So like we just heard, the purpose of this report is to give you an annual update on our delivery of Welsh Government's Children and Communities Grant and to give you the outline plan for the next financial year. It is a sizable grant. So in 24-25, the total grant was £5,491,659. The money, the grant is quite prescribed on where we can and can't spend it, and it's broken down into a number of different areas. The report does go into details. I'll just give you a very quick list to overview, but there is a section of the grant that focuses on childcare and play. It funds the Families First projects, the Flying Start projects. There is an element linked to the Child Development Fund. There's elements around promoting positive engagement for young people at risk of offending, which is called PPE, but not the PPE that you put on your face or on your hands. It funds the St David's Day Fund, Holiday Playworks programme, and out-of-court parenting support. So there is an awful lot of different areas that this grant does cover. We will not have time to go into all of them, and in fact, even the report doesn't cover everything because it would be a very, very lengthy report. So within the report, we tried to give you a summary of some of the key activities, some of the key statistics. But if anyone does have any questions outside of that, we'd be happy to take those away and to get you a response. Rather than spend the time today running through the report in detail, I brought some colleagues with me who are going to share with you some case studies so that you can get a feel for the actual difference this grant is making in people's lives. So the first case study is going to be presented by Sam, who will introduce herself and then move on from it, if that's okay. How do I turn this off?
Yeah. Okay, can you hear? Yeah. Good afternoon. I'm Sam Owen. I'm the Partnership Manager for Conway and Denbighshire Justice Service. I am going to try and share my screen now, so just if you could bear with me for a second. There we go. So that's worked. That's good. Hold on. Sorry, I'm going to go back. I'm going to share it like this. Okay. So I'm going to talk to you today about a young person that we work with in the youth service, youth justice service, who has been open to our prevention service. I'm going to talk through his journey with our prevention service and just give you a kind of overview of what it looked like when he was working with us and outcomes. So, 16-year-old male, open to our prevention service early this year. He had a fairly difficult start in his childhood, early years. He was born in the UK to European parents, really complex history. During his early years, he suffered severe neglect due to parental substance abuse and domestic abuse. And at the age of 7, he was removed from his parents and placed into foster care. His foster parents then went on to adopt him, and he stayed there up until 2024. In 2024, the adoptive placement broke down due to his behaviours. However, a private arrangement was made at that point, and he went to live with some friends and their father. During this time, his behaviour further deteriorated, and at that point, he was engaging in some really, really risky kind of behaviour out in the community. He'd completely disengaged from school. He was using substances such as ketamine and cannabis. Was committing offences such as theft and common assault. And whilst he was residing with these friends and their father under this private arrangement, there was a complete lack of routine and supervision, and which led to him having the opportunity to engage in these really, really difficult and tricky behaviours. At that point, he did become open to our social care team, and it was, it was felt that that placement was really unsuitable. So he did move back into foster care in January of 2025. And it was around about this time that he also became open to our prevention service in the youth justice service. So it was really critical in terms of timing, really. So there was two things going on here. He was moving from a really unsettled placement into a bit more of a settled placement, and he'd also been referred into our youth justice service. What this offered at that time was a kind of period of stability. So, like I said, going back to what I said, it was really critical timing for him to get this foster placement, because it allowed more of an opportunity for us in the youth justice service to engage with him and undertake some effective work. So, apologies, lost my place here. So back into foster care, a bit more settled, more stability. We saw immediate improvements in his routine, in his well-being. We saw that he had started to re-engage with education. So he'd been out of education for some months, but actually what he was doing now was going back to school. He was even attending additional catch-up sessions. He had aspirations. Oh yeah, we have. Yeah, I'm still sharing, so I don't know. There we go. Thank you. He'd had aspirations to join the army, so he had started to attend military preparation college for 2 days a week and had that goal in mind. So it was, we started to see significant improvements. He was attending the gym regularly. He had an improvement in his routine, improvement in his sleep, which led to an improvement in his self-esteem. And he actually went on to win an award at military college for Student of the Week. So how did we get there with male A? Well, like I said, what was critical was the fact that I think he had gone back into a foster placement, which did offer him a period of stability. And it's about timing at the end of the day. So as case managers, we see that opportunity. We see a child is ready to make changes, and we go in and we start to make those changes. And the approach we used was, offering male A emotional support, very much a trauma-informed approach, because what we have to remember that is male A's early years and beyond that, he suffered significant trauma. We offered him the opportunity to engage in positive and pro-social activities, such as attending the gym, and attending military college. We completed substance misuse education work with him, so doing pieces of work around the consequences of using substances such as ketamine and cannabis, and then also focused on the consequences of offending. And it's really important to say that these interventions need to be offered in sequence. So we need to prioritise what the need is at the time. So I think for Male A at that time, the priority was getting him a secure and stable placement where he felt safe. The second priority was making sure that he had that emotional support, building that trust between him and his caseworker. And it's at that point then we can start to introduce some more intensive type of interventions, such as the substance misuse education and the consequential thinking. There were barriers to his engagement that, you know, there usually is with our young people, often because they are often in crisis, facing trauma, there's lots going on for them. There's usually always a period of kind of initial resistance to working with the Youth Justice Service. They need to build up trust with their caseworker. As I've already mentioned, you know, there's emotional instability. So bear in mind, this young lad has gone through a lot of turmoil through his life, into foster care from 7, adopted, safe placement. That adopted placement breaks down. He's then sort of sofa surfing with friends. That's a completely inappropriate placement. And then he ends up in a foster placement that offers a bit more stability. So he's gone through a kind of whirlwind experience. So, you know, that would act as a barrier to completing work with us. And also recognising the physical and emotional withdrawal symptoms from taking substances as well. But part of our role is to work through those barriers to help that young person knock them down, break through them. Okay, so positive outcomes today. So Male A is no longer working with us. He's closed on his order successfully. There have been no further offences since he was open to us. He offered full engagement with his caseworker. He's completed all of his reparation work. He continues to attend the gym. He no longer uses substances. He's gained significant insight into his behaviour and the consequences of returning to offending. And he's actually applying to join the army in September. And he's really, really motivated to be successful in that. So a really, really positive outcome, you know, with challenges throughout the journey, but really positive outcome for Male A. Thank you. Thank you very much.
I can just pick up then. How do I get it back onto me? So fine. You can stop presenting. That's great. Very good. Yeah. So it just gives you an example. We thought that would give you an example. It's real case study to look through as to work that the Youth Justice Service are doing with this grant. In the last year, Youth Justice received, let me look at the numbers, the results in 362 young people receiving support and intervention. So that's just that's one of the really positive examples. But they supported 362 young people in the last financial year. Next, we have Tom Lowe.
Are we going to take the questions now, or?
I think we had better do it at
Or
the
you'd like
end.
to do it
If
at
that's
the end?
okay. Yeah, otherwise we'll
Okay,
get a bit
yeah.
distracted, if that's okay.
Councillor Liz, are you raising a point of order? You're muted. You're muted, Liz. It's still muted.
No. Councillor Liz, we can't hear you. Can you hear us? Were you coming in with a point of order? You had your yellow hand up. No, can't hear.
I don't think so.
Okay, we'll send you the instructions, Liz. We'll send you some instructions. Sorry.
Okay, right, we'll back to Mark.
Okay. Right, I'm trying to see if I'm speaking. Okay, so that's the first one, and then Tom is going to take us through a case study in relation to our family centres and some of the work that they're doing.
Bear with us for a minute. There we go. Wasn't plugged in properly. Hi, so I'm Tom Lowe. I'm the grants manager in social care. I sit in Mark's team, Quality Standard Commissioning. So I've just got a quick case study that was sent to us by one of the family centre section managers. So the case study is based around delivering the early bird course to parents and carers of families who have children aged 0 to 5 who either have a diagnosis of autism or currently on the waiting list for assessment. So the course is jointly delivered by a member of the Flying Start childcare team and a member of the Portage team in Conway. So they're both trained by the National Autistic Society to deliver this course. The course covers various areas, excuse me, understanding autism, understanding and supporting sensory differences, communication, supporting and developing interaction, understanding and developing play, understanding and interpreting behaviour, and supporting behaviour. So each of these themes is explored, and there's time allowed for the families to unpack how each particular aspect impacts on their child, and they can share any experiences that they wish to explore in the future further. So the group is delivered with the key message that the parents are the experts on their own child, and that the practitioners are there to give theory, practical tips and examples from their own experiences of what might work and when. The group's not overly formal. There's no pressure for them to contribute anything to discussion if they don't want to. The parents and carers are all at various stages of understanding what autism is, or more importantly isn't, and accepting their child's needs. Sadly, all the participants have experienced first-hand ignorance and intolerance of this hidden disability at times from members of their community, and expressed how isolating they have felt sometimes. So the most recent course that was delivered, there were 14 families invited and 6 families accepted. One of them dropped out at the very last minute due to childcare. But of the 5 families that attended, there was a mix of attendees. There was dads, mums, there was a grandma, and a family worker that was also supporting a family. Oh, is it a bit? Is that better? Is that better? The worker has said that they could actually present a case study for each participant because they've all moved on in different ways. But I've just focused on one particular participant just to give you a flavour. So parent C was quite open about the level of overwhelming anxiety they had at the thought of taking their child to the supermarket and other places like that. So this course allowed parent to develop their understanding of their child's daily sensory experiences and how this is likely impacting on the child's ability to regulate. So this in turn impacts on the behaviours that they display. So parent C was able to share their challenges and their celebrations with the group in a safe space where everybody understood. The sessions enabled parent C to understand why the use of visuals was important to prepare their child for changes and transitions that were going to happen. Course C gave parent C not only the experiences of the staff delivering the course, but it gave them the opportunity to network with other parents and to listen to what they found useful for them. In particular, the parent was anxious about their child stopping childcare for over 6 weeks in the summer, and they also had concerns around them starting nursery in September. So during the course, all the parents were made aware of sensory sessions that are being organised jointly between Flying Start childcare team and the Portage team, and early education advisory team. So for the 3 weeks in the summer, there's an invite-only group that families can attend in a secure area of a natural play space where they can join with their children. They were also given information about the summer sessions being offered across Conway by the 5 family centres for families with additional needs. These sessions are invaluable for families with additional needs over the summer, so this helps them engage with their children and know that they can attend with other families that will be supportive and understanding, and the parents and carers won't feel judged if their children respond in certain ways to certain situations. So by week 4, the parents on the course had actually created a WhatsApp group between them where they can contact each other and offer peer support, and they all said they found that really useful. At the end of the last session,
The family worker delivering the course spent time with Parent C, discussing and writing a one-page profile that they could take to school with them for their stay and play day, so that staff there have an overview of what's important to the child and what strategies need to be in place to help them settle into school. So Parent C took this with them and fed back that it worked really well. School have reassured them that the strategies they've described are things that they can have in place for when their child starts. Lots of the strategies that were discussed in the Early Bird course, Parent C has tried and tested and has found them to have a positive impact. They said that having that one-page profile meant that Parent C had everything ready to look at with the school, so there was no need for them to worry that they were going to say lots of negative things to school staff, that the child may hit them, throw things, climb on furniture, that sort of thing. So the Early Bird course allowed Parent C to see past these behaviours and consider why the child was reacting to situations in this way, and then look at what strategies may prevent the child from getting to the point of feeling they need to react in those ways and keep them regulated. Parent C also described many of their own traits and needs from their childhood and are now having discussions in the group, and it has made them feel that they may themselves be autistic, so that's helped them out in their own personal life as well. So good outcome.
That's great. So again, we'll take questions at the end. I'm sure as members know, we have the 5 family centres in Conway. Those are funded, and the staffing and the courses they run is all funded through this Children and Communities grant, and is probably one of the main and most important areas of how we use this grant money in Conway to provide that early intervention and preventative support to families. Last year, the family centres across Conway received 754 referrals to them, in addition to all the different courses and different support that they offer. And they're a really important facility, a really important service that we've got. Can't go through 754 case studies, but that just gives you one example of the impact that the work the family centres has had on that family and on that young person. The final one we've got for you is Caroline Jones, who's from our leisure services. We don't just deliver all of this grant within social care. We work in partnership with other parts of the council, as well as quite a number of third sector organisations and the local health board. You can find in the report a list. I think it's table, it's in section 3.4, where you can see the financial breakdown. But as part of that section, it gives a list of all the third sector organisations, of the local health board, and also the other parts of Conway County Council that we work with. We work very closely with education services and very closely with our leisure services. And when funding allows, we do work very closely with our libraries and with our theatres as well. So Caroline is going to present to you some of the work that they've been doing over in leisure.
What did you have to do, Tom? Oh, okay. Will do. Okay, so just to give you a little bit of context, as Mark said, we've been working through CCG funding to deliver play development opportunities within the county for probably the last 4 or 5 years, when play came back in-house really after being contracted out. And we started off with 1 member of staff as our play development officer, and to date we've probably got a team of around about 25, with 2 full-time members of staff and the rest are sort of sessional play staff. So the play development programme is sort of set into 3 different areas. So we've got the training, where we're engaging with community engagement and a volunteer training programme. We've got the delivery of term time provision through our Playing Out programme, and then the delivery of the holiday programme. So with us having a dynamic team in place, we can sort of make good use of not only the CCG funding, but any other funding that comes our way. So we've been running a pilot Have a Go project prior to CCG coming on board with some additional funding. So the Have a Go project is specifically for 11 plus, so really year 6 that are going into high school,
who may think that coming along with the sort of 5, 6, 7, 8-year-olds is a little bit beyond them and it's not cool, it's not the thing to do. So we've put on some specific provision for them. We've helped obviously run Playday and other community events, and we're involved with education and youth service through the Food and Fun project. So some stats for last year in relation to playing out. So we delivered 360 sessions, just shy of 2,500 individual children attended, and just shy again of 1,800 adults, whether their parents, grandparents or carers, attended those sessions with the young people. In relation to Have a Go, 38 sessions have been delivered and 364 individual older children have attended those sessions. So a little case study from Playing Out. So the child attended a Playing Out session. Mum told the team that the young girl struggled to socialise, lacks understanding on how to make friends and form positive relationships with her peers. She obviously gets frustrated as a result of this, and at times can sort of demonstrate negative behaviour. So through attending the sessions, exploring opportunities, being supported by the play staff, and some reflective practice with the team, she's engaged with other children, made social friends, and has been allowed to use a reflective space independently when she needs a bit of time out. So feedback from the youngster, she told the play team that she loved coming to the play sessions. Excuse me. Her favourite thing was a chance to make friends, and Mum also said that she loved seeing her daughter becoming more confident, and hopefully she'd take these skills into her up-and-coming new school year. And then similarly, the Have a Go, the older session. So for the first session, a child arrived, he was uninterested, didn't really want to be there, didn't respond to any conversation and wanted to go home and play on the PlayStation. Week 2, he didn't attend. Week 3, he came back, pretty similar mood to week 1. However, he did attempt to engage in some conversation with the play team, and they started to figure out what his interests were. So they provided him with a toolkit and a palette and a saw and a hammer, kept him interested and happy for the majority of the session, allowed him to sort of engage more in conversation, and when other children came over to see what he was doing, he was happy to engage with them as well. So he returned on session 4 and he was asking for the tools again, which the team provided. That kept him engaged and started to begin making friends with others who were coming over to see what he was up to. And then by session 5, it was clear that he really enjoyed helping the younger children with the tools and showing them what to do and how to be safe. So full circle, really, he then became a really good role model for those other youngsters that were coming up to him. So in terms of feedback, 100% of the children that have been asked reported feeling happier when they were attending Playing Out sessions. 81% of parents said that the sessions had helped support their child's learning and development needs. And 97% of parents said they'd helped with their child's emotional and mental well-being. So in terms of our next steps really going forward, obviously expanding the training and the workshops that we're able to engage volunteers in, just making that sort of play workforce bigger and better within Conway. Some more sort of local child-centred research and development, and to keep on expanding the provision where we can to support parents and children, and develop older children messaging with all stakeholders. Thank you.
Brilliant, thank you very much. And then the Tommy's going to talk to us again. As I'm sure you all know, a large portion of this grant is around providing funded childcare, get my terminology right, within the Flying Start areas. We've had various levels of expansion of where those areas are and what is offered under this. and Tom's just going to talk you through where we've come so far and what the plan is for the next year, in line with it's very much in line with what Welsh Government have published, isn't it, and said is their goals. Just going to give you an update on that, and then that is the last of our presentations, and I'll probably just finish off just to sum up what's happening next year.
Sorry about this. Yeah. Okay. You'll have to see my note.
For those of you online, we're just trying to sort the presentation. Bear with us.
I'll have to leave it with my notes, and I can't get rid of them. But it's only what I'm going to be saying. So there's nothing. I haven't written anything in there that nobody will want to see. Hopefully. So I'm just going to talk a little bit about the Flying Start childcare expansion. So we're actually at phase 3 now, believe it or not. So just the background is that the Flying Start is the Welsh Government's flagship programme. So this helps families and children under the age of 4 in disadvantages across Wales. So the help is in 4 different themes. That's the funded high-quality part-time childcare for 2-year-olds, the enhanced health visiting service, accessing to parenting support through our 5 Conway family centres, and support for speech, language and communication development. So the childcare element is one of the essential components of the offer. We've got a dedicated childcare advisory team in Conway, so they ensure that all our families are fully supported to access this free funded childcare for 2-year-olds. So it's the term after their 2nd birthday to the term after their 3rd birthday, so that fits in with the childcare offer. They also enable our settings to offer high quality provision to our families. So I've just quickly done a couple of stats in there. Good job I've got my glasses on because I can't see it very well now. So we have supported 50 settings to deliver high quality childcare to our families. The attendance rate of Flying Start funded children at settings was 76% last year, and that would rise to 90% if you included the addition of the authorised authorised absences. So that's like doctors and hospital appointments, things like that. We funded, I'm going to have to move in here because I can't see, 851 children to attend 71,923 sessions over the year. So you can see there's a lot of funding gone into that and opportunities gone into that. Our 6 childcare development officers, which sit in the Flying Start childcare team, have visited the settings 682 times over the year. 100% of the children who requested a Welsh language placement were offered a place in an appropriate setting in one of our KILs, Flying Start KILs. 100% of eligible Flying Start children were actually offered a place in one of our settings last year, so that was good that we were able to do that. So the initial Flying Start core areas, they were set in 2007. So they used the Welsh Index of Multiple Deprivation that gave you a list of the highest level of deprivation in our county. So we targeted the top lower super output areas on the list. So this was Colwyn Bay, Old Colwyn, Llysoen and Abergele, and Mochtra. So initially this allowed us to reach 1,067 beneficiaries across Conway in those areas. Then phase 1 came in, so that was all the 4 elements of Flying Start. Phase 1 was also all of the Flying Start services. So they introduced this expansion, which enabled us to offer the services to an additional 74 children. So this brought our cap up to 1,141 beneficiaries. So these areas we decided using a variety of data sources. So we used the WIMD again, free school meal data, children looked after, children in need data, and also we had local knowledge from professionals working on the ground. So that was from the family centre teams, from health visitors, midwives, anyone we could get help from. So after consultation with yourselves, with the councillors and our other governance groups, it was decided we would target Llandudno, Cymnal Bay, Tywyn and Pembermawr. Those were the areas that we felt we needed to move to next to offer support. So then phase 2 happened the following year. So they restarted from April 2023. So this focused just on the delivery of the high quality childcare to 2-year-olds. It didn't have the element of the intensive health visiting in there. So again, we consulted with everybody in the governance structure, and we offered options of where to expand to with this particular element. We then decided on Llandudno Junction, Llanrwst, and then the surrounding areas. So this meant we could bring on an additional 145 beneficiaries across Conway. So then phase 3. So phase 3 was announced by the Welsh Government in March 2025 and expected us to start immediately, which was obviously quite difficult. This would allow us to reach an additional 148 beneficiaries across Conway. As we're quite a small county in relation to other local authorities, this meant that potentially we could reach all of the remaining 2-year-olds across the county. We also had in the previous years an element of outreach where we could target referred families into the programme. So this now became part of our core caseload. And to offer phase 3, we would need to have a targeted rollout of the offer. So we started up by signing all those 2-year-olds who were already in our Flying Start settings, but they weren't eligible for Flying Start because of their home location. So we will continue to deliver phase 3 expansion throughout the year, and Welsh Government have given us an indicative budget to deliver this for the next 3 years within the CCG. So just some of the challenges and barriers. So the biggest barrier probably for us was identifying the eligible 2-year-olds. So for previous phases where they've included the health element, we could identify the beneficiaries, health supplied details of them through the child health system. However, with the subsequent expansions, which is the childcare only element, the local health board was unwilling to share this information because of data sharing processes. So second challenge is capacity within the sector. So we know that we've got a shortage of places available in the childcare settings in certain particular areas where there's high need and also high capacity of residents. We're finding that there aren't enough spaces available. So the childcare team's working hard to bring all settings onto the programme. Obviously this takes funding and time and additional resources, and also some of the childcare settings in Conway don't want to sign up to the scheme. Staff retention is a bit of an issue within the sector. So we know that there's difficulty recruiting people and retaining staff. It's sort of historically been a poor paid career, so we're finding it difficult to get people signed up for that. There's also a qualification framework that the settings must achieve in order to offer the Flying Start quality standard, and this has put some settings off joining the programme, but we've been working with the Welsh Government to try and overcome that issue. So this also caused additional workload for the Flying Start childcare support team, so they've obviously not had more staff to deliver more work. Each setting has to be audited by the Flying Start childcare team to ensure that they meet the quality set by Welsh Government. So this is quite intense and time consuming and has to be completed alongside their other usual support work that they provide. Also, we have a shortage of Welsh language settings. So part of the focus for this additional childcare was for it to be a Welsh language focus to improve Welsh language childcare. We've got a shortage of Welsh language settings in Conway. So that's been quite an additional pressure for us to try and get them on board. And then finally, so we've had quite a successful rollout already. We've managed to sign over 200 beneficiaries since April. I think we're actually about 230 at the moment, so well over our initial target of 148. This has been due to the team just working hard to sign people up and get them on board. So this has exceeded our target, and it means that we're closer to offering free funded quality childcare to all 2-year-olds in Conway. That's it. Thank you.
Great, thank you very much. So yeah, we thought that was important to present that, because that is quite a major change. With Flying Start, it used to be postcode based. If you lived in the areas, then you received this funded childcare. We've made the big decision this year to expand that out to the whole of the county. So all children of the right age with anywhere in Conway, there is no longer any postcode lottery or anything like that, is available to receive the funded childcare support. And the challenges now are having enough places and enough settings to provide that childcare. Just to finish off then, the tables in 3.4, they detail where we're spending the money. We've given you all the information that you could want. So everything is in there for the last financial year. Everything is in there for the next financial year. We try and bring this to scrutiny as early as we can in the financial year, so that members of the committee have chance to input into where that money is being spent, so you can hear what we are doing and have influence then over the next year. If there's any areas you feel that we need to be looking at, or any questions or anything like that, this is the opportunity to get involved in where we're spending this money. The grant has been increased by Welsh Government. So they have actually increased the grant to 6.2 million next year. So that's the year we're in now, 25-26. They have, however, ring-fenced quite a large portion of that for the expansion of the Flying Start childcare, which is why we spent the time just to present our plans to you on that. So I think now it's time to open up to any questions.
Okay. Have I got any questions, members? Paul? David, after you? You're after, yeah?
Chair, I mean, it's a very big report and it covers many things. I wanted to focus on two areas, but because they're different areas, can I suggest I ask the first question and that's responded to, and then I ask the second question, because otherwise it'll be a bit complicated. Is that okay with you, Chair?
Yeah.
My first question focuses on the various, if I can call them, packages or projects in relation to early years education and care, including Flying Start. So it's not just the Flying Start I'm going to sort of question on. And thank you for the very positive reports. That's encouraging. But when I listen to young parents, as I often do, local to me, about the whole early years education and care package that's available, and I also listen to the businesses that provide them. And when I say the businesses, I mean everything from childminders, right through to our sort of biggest and most prominent provision of nursery type provision, early years provision. There are a number of things that constantly are raised with me and are complicated. And what they say is just the complication of all the processes. So what young parents say, I had only not long ago listened to a young mother. She was in tears because she was paying £73 a day for her combination of childcare that she needed. She was working, her partner was working, they were on relatively low incomes, and that was a real challenge. I've listened to other parents who go from different settings to manage their childcare, so they're not getting all their childcare during the week in one setting. And for them, one of the major issues is sort of transporting the kids between the settings, particularly if they themselves, I was talking to a mother the other day, she said it's really difficult because I've got a young child, a 4-month-old child, I'm breastfeeding that child, and I'm also taking children to childcare facilities. And she said, actually physically getting them there is a real challenge. You highlighted in your presentation about the course that you were running for those youngsters with additional learning needs, neurodiverse, that course. You said one parent dropped out because there was no childcare, and that is a major issue, I think, not just for these opportunities, whether at the family centre or whatever, for these people, but also for staff. You were saying in the play, they've got training programs to go on, and I've argued previously to today, in the 3 years I've been in council, we really should have a mobile creche facility. When I say a mobile creche, as part of your whole package, because if you had a mobile creche facility with officers, that would support a range of parents, either employees or other beneficiaries, to attend those courses. And again, on the business model, as you were recording, some businesses don't engage because of the demands of the engagement almost. And this is a constant issue, not just with businesses, but even community groups that are trying to get funding. They just put their hands on their head and said, oh, it's just so complicated, demanding, I have to spend so much time. I just don't have the will to do it, for the benefits of my business are relatively small. So I'd be grateful if you could answer some of those questions. And also this question, which I've had discussions with Jenny Williams about, in some reconfiguration of our family centres so that they can provide a bigger offer, particularly for some children and parents whose, if you like, threshold of need is even higher than some of the children. And I'm thinking particularly of children in need, which you've actually identified as being children in need. I'm sorry, there's a lot to that, but in a sense, we could have had that one item as an item on the agenda because there's so much to unpick within it.
So there's different aspects for that. I think I'm sure you probably already know this, the answer, but the process around defunded childcare is dictated to us by the Welsh Government, and we echo all of the frustrations that you've mentioned and that families have mentioned, and I think pretty much, looking at Tom, every local authority in Wales is feeding back these things and has been feeding back these things to the Welsh Government for quite a while now. They are aware of them, and I know they are considering them, but really it's at that level. We would very much like them to simplify the process and make some changes, but at the moment we're not seeing that, are we? And yeah, we would agree with you. It feels overly complicated and overly challenging, which is why some businesses don't engage and why we know some parents do end up in these difficult scenarios. I think one of the points you've raised there is we don't have enough childcare within the county, do we? And we know that, and there is teams that we have within our service and within education services who are working to try and increase that offer. But at the moment, we don't deliver any of that ourselves. I know some local authorities do deliver in-house childcare. At the moment, Conway, we don't do that. and we're reliant on the private sector to pick up that service. And there's various challenges. We have been doing quite a bit of work reviewing the funding that we give, but as with all things, the funding is tight that we get from the Welsh Government. We do, although it's a £6 million grant this year, we do an awful lot with the money that we get, and we have that constant balancing act to do that. But that is something we've been looking at as well, is reviewing the funding, trying to make sure that our funding is in line with other local authorities, that we're getting it right. It would be useful if there was more engagement from the sector to help us get that balance of funding correct. In other sectors, we do have good representation and bodies that represent the sector that we can work with. We don't quite have that here yet for childcare, but that would be good to understand, to get that funding right, so that it's encouraging new businesses to come into the area to fill these gaps, rather than, like we've heard, them all struggling to balance those things. The family centre offer itself and the use of creches, I can't comment on. I don't know if there's something you would want to say on that, Tom or Catherine.
I was just going to say that so a lot of the courses do actually provide another session alongside those training courses so that the children can go to. So not necessarily creche, but they'll have like a stay or play that they can be left with some of the family workers there. Also, just to pick up on what Mark was saying about the early years sector. So there is some consultation going on at the moment to try and align the Flying Start funding with the 3-year-old childcare offer, and bring that all under one, not scheme, but pathway, I suppose, so that families know exactly the pathway they need to take, over the years, sort of thing. So that's a work in progress at the moment. It's quite difficult because the offers are very different. They're different amounts of time, as it were. So it's 12.5 hours for Flying Start, but also the Flying Start provision is more about settling the child in early, identifying any issues earlier, and giving them the opportunity to sort of socialise with other children, get them school ready. Whereas the childcare offer, obviously, that's a lot of that is more about parents being able to work and going into work, and having the space to do that. So they don't quite marry up, and that's a difficulty that we've got to face. And it's the same across the whole of the sector across Wales. Every county is saying this, that they've got exactly the same issues that we have. Not that makes it right, but yeah.
Can I just come back on that?
Thank you. And thanks for that question, Paul. I'm not sure if you were at Midif when I presented around the role of social care and children's services, but there's a really useful slide. I'm happy to send you the slide. I can't take credit for it. It was Kathy Mackenzie's slide with an explanation of increasing services, the benefits of early intervention and prevention, but if we cannot succeed in early intervention and prevention, what steps, literally a staircase, we can add on. Some of those come from family centre referrals and some from elsewhere. But if that's useful to you, I can certainly send that. Councillor Paul.
I've got those slides, and thank you for the offer, but I did attend, yes.
Okay.
The issue, again, to follow up, is I'm not persuaded the civil servants who design these schemes talk enough to these young parents. Or maybe they're not young parents themselves, because I think if you are a young parent and you're a civil servant designing this, you would think about it in very different ways. And I know we are very anxious about not taking risks and safeguarding, but I cannot believe more simpler arrangements, not just for you as officers in local authorities, because I think your job is almost, I'm not sure the fulfillment from your job because of the frustrations about how to implement these grants. And I just think, I mean, I appreciate Welsh Government's not here, but I'd love to talk to Welsh Government and say, just go out there and start by talking to the parents that are going to receive these services, because I actually think they design things before those really detailed conversations take place, and that's why we're in that situation. Anyway, thank you for that. Can I just raise my second question?
I think Councillor Cathy want to come back on that. Yep, you're there.
Yeah, thanks. It was just a reminder, Chair, that this is a huge report, very, very detailed and of great interest. But we are here, obviously, as a scrutiny committee, and our agenda is to scrutinise this particular report. The committee is convened with an agenda, so I'm keen that we don't stray off into personal agendas. Thank you.
Sorry, thank you for that, Cathy. Have you got another quick point, please, Paul?
Yeah, well, I don't think that was a personal agenda. I'll let the committee judge whether that was a personal agenda. My second question is to do with promoting positive engagement for young people at risk of offending, and I've got some specific questions on this, and this won't be a surprise to anyone because of my concerns about children trading drugs, substances, gas, vapes, and using them as well, and the safeguarding issues around that. Now, I understand here this grant has funded engagement with 362 of those children over 12 months. Can we know how many staff are directly funded by this grant and involved with those 362 children? And the reason I ask that, because even in your case study A, you identified some of the problems that youngster had was because there were periods during his journey, if I can call it that, when he didn't have supervision and engagement from professional staff. And that is always my concern with this group of children, is the times they're disengaged, if you like, from a professional service, because I think that's the time that they're at most risk and where the safeguarding issues are greatest. So I'd be grateful if you could just answer those two questions. Thank you.
Thank you, Paul.
Mark? Okay, I can't tell you the staffing numbers, not going to hand. In the report, it tells you that the Promoting Positive Engagement received £291,000 worth of funding, and all of that goes on staffing pretty much without the small expenses. So I'm not quite sure how many staff 291,000 funds. I'd have to go back and find out for you.
Could you write to me on that, Mark?
Yes, I can find that out, yeah.
And on the other issue, then this concern to do with specifically these high-risk children trading these drugs, substances in different places across Conway. My concern is that not that they're not known to the police and to yourselves, but that there are often extended periods when there isn't a professional officer directly engaged with them and their family. And are you telling me that's not true, or is it true?
I don't think I can answer that question. Yeah.
Oh, sorry, Cathy, did you want to come on?
Sure. Can I just ask for some clarity on what Councillor Paul means by professional officer? Because children at risk in this way are known and have access to all sorts of services through school, through family centres, through the whole list, really. And our officer here is nodding and can maybe help with that, because professional officer can mean a number of things. We have a vast range of services to look at children at risk and mitigate that risk. So perhaps more clarity on that question, and we have an officer here who could potentially answer that. Thanks.
Yeah. Briefly, Paul, if you will.
Well, no, I mean, I was just picking up...
Microphone. Flanagan.
I was just picking up on even in the case study, it was acknowledged that here was obviously a child on a difficult journey, and in that difficult journey, when it was suggested he was involved both in offending behaviour and using drugs and substances, there was a period when maybe the supervision and or the engagement from appropriate professional officers did not take place.
Okay, well, are you going to answer that?
Yeah, I think when we look at the example and
Yeah, bring your bike down towards you.
is that better? Yeah. I think when we look specifically at the example I've spoken about today, I don't think it's necessarily that there was no engagement from the professionals. I think the engagement lapse with the young person, and the professionals are continuously attempting to engage that young person. So I think, like Councillor Cathy says, at that point in time when that young person was in that crisis moment, when that adopted placement had broken down and he wasn't in education, it wasn't from lack of professionals trying to engage him. Schools would have put the relevant referrals in, visits, knocks on doors. It's about grabbing the opportunity, and I think that's what we had to do with this young person, is try and engage him through that journey. So I would probably say that there aren't periods of time where there's a lack of engagement from professionals. It's about a period of difficulty of us trying to engage that young person, if that answers the question. But
Thank you.
Thank you.
Yep. Thank you, Paul. I think it's Councillor David. It's your turn.
Thank you, Chair. Just some comments and questions. Autistic funding for autistic children, is that nearly all grant-based, or do we actually have provision within the council budget for that? And are we covering all children that are identified as autistic within the county? Are they getting the help? That's the first thing, so someone can answer that. The next one is about staff retention.
David, bring your mic down a bit. Excellent.
Right, can you hear me now? Yeah, thank you. Yeah, the other one is about staff retention. Are we having problems retaining the staff? You know, as I said, it's identified in the documentation we received, because it's grant-based and we can only offer short-term contracts. Is that the real problem? Or is it a problem of pay, that we can't attract people to do that kind of work? You know, or is it a mixture of both, really? That's the other question. Courses during the summer that we see from leisure services. Now, this provision for the poorest families, we do know that. There's a lot of families that are on fairly low incomes that maybe have 2 or 3 children. I know them in my ward. They're not really getting any help. These are very expensive. Some of these courses, like for swimming and other things, £80, £40. If you have more than one child, all the children will want to do it. Can we put some more money into that? Because they are very, for the parents that do have to pay for these courses, they're far too expensive. And really, people do, particularly in my ward, you know, people feel a little bit excluded, that there's no way they could afford those kind of costs. The final question is about it's great that we can actually provide the care for the 2-year-olds for the nursery. Can we provide places in schools for the age when they get to age 3? I mean, is there any funding for that? That obviously, you know, we've got this for 2-year-olds that we can offer these childcare places. Can we offer something for the 3 to 5-year-olds who are in the schools in reception? Because it's a great help to parents that have to work, that the 2-year-olds, and then when they come to 3, they're in a problem where they've got to pay for private provision, and that can be very expensive. I think, as Paul alluded to. So they're the questions on the autistic funding, on the staff retention, courses during the summer, and the final question was about can we actually get more of the parents that need it, more of the children into schools between the ages of 3 and 5, and can we get some funding for that? Is that possible, do you think? Thank you.
Thank you, Councillor David.
I can answer a couple of those. I'm not sure about the funding for autistic families, but there is, we fund some of that through this grant, but there are other grants available that the family centres use. Unfortunately, the section managers for the family centres aren't here, because they'd probably be able to answer that a bit better. In relation to the staff retention, that is the businesses that are not retaining their staff. We can't directly influence that, obviously. We've worked hard to do some work to increase the offer of what we pay each child for their session. That's increased. We put that up by 8% this year, which was as much as we could up it by, wasn't it? And then we'll look at reviewing that again next year to offer more. So obviously that has an impact on how much they pay their staff. But it's a very underpaid sector anyway, and I think that's the issue. They can't get people on board for it. What were the other questions I've forgotten? Oh yeah, leisure. Yeah. Oh, sorry. I can just also the childcare offer is funds sessions for 3-year-olds upwards, 3 to 4, I think it is. So there is funding in place for that. It's just that we don't have any direct relation to that because it's delivered by the Welsh Government directly. So it's called the childcare offer for Wales, and I think that pays up to 10 hours in childcare a week. I mean, I know it's not a great deal, but I think that is also needs based. But there is some funding for that.
Catherine, did you want to have a word?
Yeah, I can't comment specifically on the courses that you mentioned there because they're all facility-based activities. Everything that I do within the leisure development section, and certainly from the play aspect, is free of charge for people to attend. I can pass your comment on to Mally Tidswell.
Yeah, I think it's very important for the parents that work that are not on the highest of incomes, that find themselves in a position where they'd be great if their children could go on these things, the swimming courses. They're very, very expensive, aren't they? Really, and as I said, some families do feel excluded. I know it's not directly from the grants, but maybe the authority could actually not be charging these kind of high costs for these courses because, as I said, there are families in my ward that just won't be able to afford. And if one child goes on one of these courses, and you've got more than one, the other children want to go on as well. So if you look at £80 cost and you've got 3 children, it's just for a course for a week, it's extremely expensive. So thank you.
Yeah, Councillor David, thank you. Councillor Austin.
Give you a chance to put your headsets on. I've got 2 questions and I'll ask them separately to have a separate response, please. First is about Flying Start. You were saying that there was a lack of Welsh medium places. What did you mean by that? Because I'm a councillor in a ward. There's 2 schools in my ward and they have Welsh medium Cylchmeithrin. Does that mean you can't offer a service like this in the Cylchmeithrin? If you could expand on that, thank you.
So to become a Flying Start setting, they have to be audited and they have to want to come on board, as it were. We haven't got enough Welsh settings on board that can accept children that want their offer in Welsh. It's not always just about what's nearest to them. Some of them specifically want a Welsh setting that isn't available near them. So we're working hard to get them all on board. But there's still a lack of spaces in the sector in Conway because we haven't got that many kills in comparison to the day nurseries and childminders. We haven't got any Welsh-speaking childminders, I don't think, either at the moment. So that's complicated. But obviously we can only take on board those that are there.
On Manu ar gael.
They are available. There are Cylchmeithrin available. Thank you very much for your answer. The second question, and this will be for Caroline. The opportunities for play. I see there are 37 sessions held. Are there any sessions available in countryside areas? Rural areas, in the villages? because that's the bad thing. In Conwy, we're talking about rural areas such as Llanrwst, but that's an actual rural area. But there are villages, small villages around in the county. Is it possible to offer the service in areas such as Eglwys Bach, Llangernyw, Cerrig y Drudion, and areas such as this? Thank you.
So the play development programme over the summer is partly funded through CCG and is funded in partnership with town and community councils. So they all have an opportunity to put some money forward if they want specific locations, villages to be serviced by the play team. Through my rural officer as well, we do have a number of multi-sport football camp, gymnastic camps, and that is across rural Conway as well. So I can't categorically say where the play sessions are at this moment in time, but I know the summer programme is out, and I'm quite sure rural Conway is serviced as well.
And the opportunities are there if the community councils do make an application for these activities. Yep. Okay, thank you. Can I also thank you for the report? I've had to, over the years as a councillor, I've had to read many reports, and this was a report I actually enjoyed. And I can't say that very often. Thank you very much.
Okay, diolch Austin. Councillor Elizabeth, please go ahead. Oh. We can't see your picture at the moment or hear you at the moment. Liz? Okay, I think I've got Councillor Nigel next, if you can hear us, Nigel. We'll come back to you, Liz.
Yeah, can you hear me, Chair?
Yes, I can.
Excellent. Seem to be having a bit of an issue with the sound on this. But anyway, first of all, I want to thank Mark for this report, which gives a clear overview of how we're spending the Welsh Government's Children and Community Grant over the last 12 months. It's eye-opening to me as a member that doesn't attend this committee very often. The fact that our social services staff have helped out 362 young people this year, of which we heard a harrowing story about a young man who was perhaps straying off the straight line and was now got his whole life ahead of him thanks to the intervention of our wonderful staff, and also the 754 families that have been helped out as well. Caroline mentioned the good work that she and the team does with children's play and activities. It's very understated how important play is to the personal development of our young children and prepares them for future life as young adults and into adult life. Childcare was mentioned and the lack of capacity we have in the county. Ourselves in Town in Kimmel Bay recently lost the Towing Fun Club that provided childcare for local families at a affordable rate. Sadly, they were unable to get qualified staff, and we've lost that facility locally, which is a real shame, and something that I hope in the not too near future we will see reopen. But I do have a question, and that is, I did read in here that on 3.6 on page 10 of the report, it says in the last 12 months we've seen an increase in the demand for services in Kimmel Bay and Towing for health visitors. Health in Town and Kimmel Bay areas, and health visitors are above their capacity. We're exploring funding options, and I just wondered, do the officers know why there's been such an increase in need in the Town and Kimmel Bay area?
No, is the answer to that. Partly we're seeing more because we've expanded to that area, so we're seeing more families. But other than that, I don't really know, unfortunately. I don't know who would know necessarily.
Okay.
We haven't seen anything on nothing
Because
specific.
I had the sneaking Sorry, I had the sneaking suspicion that when I first joined the council, we had the community house down Chester Avenue, which was over brimming with officers that would and health people, social services that were helping out the community in Chester Avenue and the wider town and Kibble Bay area. And I think the funding was slowly reduced and those resources left. So I think the need has always been there. And now that resources are coming back to the area, you're picking up the fact that that need is there. So I think that's probably why. But anyway, thank you very much for the excellent work that you're all doing on behalf of our county and in particular in my area, Town and Kibble Bay in particular. Thank you very, very much.
And I can say that Towan Fun Club is actually in the process, I think, of coming back on board. So hopefully that will be reopening soon. I think they're just waiting for CIW registration. So hopefully by September we should have them back on board.
Okay, can we try you again, Councillor Liz? We're not hearing you. No. Still not hearing you, I'm afraid. Councillor Joe, can we come to you instead, please?
Thank you. Thanks, Chair. A lot's been mentioned about difficulty retaining staff in the report through various departments that are, paid for by this grant. How many people are employed by Conway or on a 0 hours contract, please?
Yeah, this
If anyone's answering, I can't hear anything. Sorry.
No, it's all right, Joe. I haven't started yet.
Okay.
Yeah, this was something I was going to say in response to Councillor David's question as well. So yeah, we don't have anybody on 0 hours contracts, but we do have all of our staff are on short-term, fixed-term contracts for these grants because they are grant-funded posts, and that does, as you say, Councillor David, lead to recruitment issues for us and retention issues because they're year-on-year funding. So when we get to January, we're constantly thinking out what are we going to get next, what's the funding profile going to be, and whether we can carry on with those posts. So all the posts that we've got are grant-funded posts, and by the nature of the grant, it is very unstable for those members of staff, and we are very conscious of that. So we are trying, and Tom and Mark's team are always trying to get ahead of the game to put the profiles in to get that funding secured for the next year. But it does lead to insecurity for those staff members. Yeah, they are on fixed-term contracts.
Councillor Jones?
So can I just come back on that? If the work wasn't available one week, they have a set amount of hours, so you can't reduce their hours in a week
pay
or a
for
month.
from the grant, but they wouldn't have work that wasn't available. We make sure that they are, but we don't have them on 0 hours contracts now.
So, sorry, I didn't hear that. So
we
can
don't
you cut their
have them on.
hours?
No, we don't have them on 0 hours contracts.
Yeah.
So they have a set amount of hours.
That's Conway staff. Yeah,
Sorry, I can't hear you.
That's Conway staff. Yeah, Conway employed staff.
Yeah.
Yeah.
Do you mind emailing me that? Because I didn't hear what you said in response. Sorry.
Yeah.
Yeah, I can email you, Councillor Joe. That's fine.
Thank you.
Okay, right. Thank you. Councillor Liz, can we try you again? No. Oh dear. I'm afraid we're still not hearing you. I had this yesterday. Very frustrating, sorry. Okay, we're trying to do something about it in the background there. Beavering away in the background. In the meantime, Councillor Cheryl, have you got a question? We can't see you, but I can. Your light is on.
Thank you very much, Chair. Probably a bonus that you can't see me, but there we go. The line's particularly bad today, isn't it? I think we're all struggling. If you look in the chat bar, everybody's struggling with the sound. First of all, just like to say a massive thank you for this excellent report, and it really showcases the breadth of everything that Conway does and how we look after our most vulnerable, and the preventative agenda, which is so terribly important for our future generations. I'd just like to ask a quick question, please. I think it's page 18. Why, it may have been covered, but I couldn't hear it. Why the big drop in children with disability play sessions? I think the spend's down from 108,000 to 23,000. Do we know why that's dropped? Thank you.
I can answer that one. It was a one-off last year. We actually had some additional grant funding last year available to us, and we made the choice to put that towards our disability sessions. The funding isn't available this year, so it was a bit of a one-off as a result of additional funding in the last financial year. If additional funding comes in this financial year, it is something we would definitely consider bringing back in.
Oh, that's lovely, Mark. Thank you, because it's so valuable to these children and families. It really is. And thank you for all your work on this. Diolch.
Okay. Councillor Liz, can we try you once again, or I'll read your statement out? No, I don't think we're working. Okay. Councillor Liz wanted to say, as the Armed Forces champion, I would be delighted to work alongside the team in supporting young people who wish to join the cadets or military. I work in close liaison with the MOD, and Councillor Julie has agreed to work alongside me in encouraging young people to join the cadets, as their latest report highlights the difference in both education and social behaviour by joining the association. How much that's an excellent thought, that. Thank you, Councillor Liz. Okay, Councillor Mandy, you had your hand up. Did you want to say something?
I was just going to read out what Liz has put, what you got there.
Okay.
Thank you.
Right. Was there anybody else who wanted to speak? Did you want to reply? Yes, please. Yeah.
I just want to say thank you to Councillor Liz for her offer, and I will be in contact over the summer if that's okay. Thank you.
Councillor Austin, please press your button.
Thank you, Chair. I propose that we accept the officer's recommendations to accept and note. Thank you very much.
Yeah, diolch Austin, and seconded by Councillor Paul. Can I have all members please show?
If no objection, we'll try and use the voting facility.
Oh, we'll use the voting thing. Right, okay. I don't know how to do that.
Okay.
Ah, right. Vote session.
So, Baron, if you could start the vote, please. And members, if you could all vote accordingly.
Yeah, you've got your green, red and yellow buttons, hopefully. Okay. I think we can close the vote now. And we have 10 in favour, so I declare that is carried. I'd like to thank the present Mark and his colleagues for their presentation today. Very interesting, very useful presentation, and carry on the good work. Thank you very much. And declare the meeting closed. Thank you.